Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We have listened to these lovely ladies before, Leslie Carmen, and of course, BECCA KALLAUS. Sorry, I got it right this time. I'll get it. At least I can spell it right now, KALLAUS. And we learned a lot from you. The first time you were on, it was almost a year ago. We heard all about what wonderful treatment a certain kind of laser can do for people with pain, which is so important. And as you showed and demonstrated on me, I mean, I didn't have any pain, but if maybe I were going to have some pain, I would take it away. But there are people who just can't even get out of bed in the morning. They seem to have gravitated to you, and you have really helped them. Otherwise, you wouldn't be still in business all this time. But you also have a wonderful, compassionate way about you, and I always believe that that's important. You ever see older adults, if they're in a nursing facility, the first thing that goes out are their hands. They want you to touch them and hold them. And so I think what you're doing with the laser treatments is part of that. You're really taking someone who's getting some care, and they need that. So why don't you start off, Leslie, with what this is all about? I know you've told this before, but you got into this. It wasn't casual for you. What were you actually doing before this happened with your daughter?
Well, before I was in a security system company, and had a good position there. And my daughter Lee started developing terrible tooth pain, and we couldn't find out what the cause was of this pain. And we went to the dentist, and he said he couldn't find any problem with her teeth, but the pain was so excruciating that she was waking up at 3:00 in the morning, throwing herself on the floor with pain. And we went to several physicians. Nobody could really find out what the true cause was until she ended up in the emergency room. And there she was then diagnosed with a disease called trigeminal neuralgia, which is also called the suicide disease. What happens is that the trigeminal nerve, gets inflamed or is, just hurt, damaged, and causes these electrical shocks in your face. And there's really nothing you can do about it. When you have back pain, sometimes you can lie in a specific way, put a pillow between your knees or something like that and alleviate that pain. But with trigeminal neuralgia, you can be driving or sitting, talking, and suddenly out of nowhere, it's like somebody's stabbing you in the face. So there's nothing you can do about it. And you develop great anxiety because obviously, you're always expecting this pain from somewhere because it doesn't come. You're not expecting it, so it just comes out of the blue. So she had to go out of school. She was put on very heavy-duty pain medication. They had suggested brain surgery, and we said there's no way at 17 we do not want brain surgery because there's death involved, seizures, and, there's no way. So I did a lot of research.
As the mom, you must have just been going wild.
Oh, I always say there's a life before trigeminal neuralgia and there's a life after trigeminal neuralgia because you suddenly think, wow, I'm in a movie. When it really happens to you, you're like, oh, so this is what it feels like. And one thing that helped me because I developed a sense of compassion and empathy for other people. So I never again looked at a mom with a handicapped child the same way as I did before. Before, you just look and you walk away. And now you look and you suddenly feel their pain. You feel their loneliness and how they must feel fighting for this child. And so I guess everything happens for a reason because I became much more aware of my surroundings, of people who have this, condition and for just other people suffering with pain. And it was the door that opened to this clinic. So I am so thankful in a sense that we went through this because now Lee is, 99% better. She's doing fantastic. She became a laser therapist, part of the clinic, and she's doing great. And we've opened up this clinic with the possibility to help so many more people with this. And there's this 98-year-old woman, and I think I talked about her last time in Miami, but she is now pain-free, and she had trigeminal neuralgia for decades. And she is using the laser, and she's doing fantastic. So in the meantime, Carmen Care has been able to help a lot of people with severe pain.
So, BECCA, did you ever know there was a disease like this?
I did not know about trigeminal neuralgia before coming to Carmen Care, but now I know the story very intimately. I know Lee personally. She's been gone for the summer, but she actually came back for a surprise visit this weekend, so she's here today, but in the office. And But the most fascinating thing that I think about the story that I always think is just amazing is that she was an avid ice hockey player before being diagnosed with trigeminal neuralgia. And she then with the pain medication, she couldn't get off the couch for more than 20 minutes at a time. But now she's not only is she 99% pain-free, I mean, I don't think she's had a shock in months, but she's on 3 ice hockey teams. She gets beat up on a regular basis, and she was playing ice hockey while being in Florida. I mean, just that combination of hot and then cold and the physical abuse on the ice hockey rink, I mean, that's just unheard of for somebody with trigeminal neuralgia. So that just makes her story even more amazing to me.
And so it's same thing, I guess, for you then. So now you're seeing a lot of patients with pain everywhere. It isn't just from that. And you kept striving to get bigger, better. I know laser, you started out, and every time I'd come, you say, oh, I have something different, I have something better, and what about this, what about that? So there's a whole field of lasers out there that do a lot of things. So why don't you go through now, fast forward, what's happening to your wonderful laser experiment? I call it an experiment because it's all working, but you keep getting better and bigger.
Yes, well, we've introduced a package deal. So, and what that means is we're doing laser therapy, but we have seen that there's so much in combination. When you do things in combination, that you get even better results. And we've been working on the CARMEN detox program, which is actually relieving your body of these substances that are foreign to our bodies, such as, let's say, arsenic or chromium. And these things are in our air, in our food, and it's pollution, and it slows our own metabolism down, our own healing capability of our body. And we've come up with a way of detoxing your body without being invasive. So no IVs, no supplements, nothing like that. Something very, very easy and beautiful to do. And so we're putting these packages together where we offer the CARMEN detox, and we're doing laser therapy, and we have a vibrational plate that actually stimulates your bone growth and density and muscle strength. And so we're putting this package together that Becca's been working really hard on with, just so that it just becomes something really special and fantastic.
And so, Becca, tell me a typical client. What would they look like? What would they feel like? What would they want? What would they be like?
Well, Anita, you were talking about just the transition that our company has had with all the new things that we've been offering, and just, I can kind of summarize how we got to that point. It started with when the company first started, it was just one type of infrared laser therapy. And now we offer a couple different types of lasers. We use 2 lasers at the same time. One of them has 4 different modalities: near infrared, LED, magnets, and ultrasound. And so the combination of those things really got us that over 90% success rate. And then in combination with the CARMEN detox, we found that, some people previously weren't healing because of certain toxins, but now we've eradicated that factor. And now we're like, okay, well, what other factors can help people increase their healing even more? So now we're doing, the vibrational plate. That's something that we're offering starting next week. That
sounds like an earthquake to me.
It's amazing. It's actually it's a technology that's used with astronauts, with NASA, because in space you lose muscle mass and bone density. So this vibrational plate, it's literally you stand on a plate and your whole body is vibrating, and it builds muscle mass through isometric exercises, and increases bone density, and also increases lymphatic drainage. So with all those toxins through that are released through the CARMEN detox, as well as the laser therapy, now this vibrational plate helps release those more effectively throughout the body as well. So we're finding with a combination of all these therapies that, no matter what somebody comes to us with, that we can help them. And so you asked what a typical client looks like when they come to us. It previously was anybody who's in chronic pain. Now it's, okay, well, chronic pain, if you injured yourself, you broke a bone, or you sprained something, strained muscle, recovery from surgery. Now it's if you want to increase muscle mass and bone density, arthritis, osteoporosis, we can help with those things as well. And are you ready for our new and exciting?
Well, I have something in front of me.
The newest one.
Pretty exciting. I can see it.
Now we've helped so many people with pain. I love, Leslie, you want to say your line?
Patients come to us, okay, so now I'm pain-free, now I want to look beautiful. What can you do for my beauty now that I feel so good?
Well, I do see a lot of advertising about lasers, and you see befores and you see afters. Maybe this is what the boomers have really created here. They're not going to go out looking like all the older people did, right? They want to stay young and even look much younger than they are, right?
Exactly.
So now we're offering something called the Venus Freeze, which is it stays with the theme of all of our other therapies, where it's non-invasive. It stimulates the natural healing system of the body. It's therapeutic. There's no risks to it. It uses radio frequency, which creates heat, and then magnets. So those together, they stimulate. They help with decreasing cellulite, circumference, and fat. So it boosts the collagen production, really tightens up the skin. Anita, you have a piece of paper in front of you that shows some before and after pictures.
I'm sitting in my mouth's open. It's amazing.
So all of those, it's between 6 to 8 treatments per body area. So it's for the body, it's 8 treatments, and for the face and the neck, it's 6. So, but yeah, I mean, you can see that just in those 6 to 8 treatments, there's really, really amazing results. It's 1 treatment per week. The therapy is really relaxing. It's enjoyable. There's no burning, there's no risks to it, and it truly gets you amazing results.
And once this happens, do they have to keep repeating this?
There's a suggested maintenance maybe once a month if you want, but it's not required to keep those results.
And so you certainly, and this has been around a little while, hasn't it?
Yes.
It's just you didn't know about it.
Well, it was something that we've thought about for a long time. And, as of all of our services, we really do our research before we introduce anything. And we really believe that this fits our, what we believe in.
Yeah. And you've done so much with so many other people. And I can see that this is going to be good for men. We always think about women, right?
Oh, sure.
And now the men are really, I mean, you're seeing so much about men wanting everything that the women have as far as looking good. And
well, what's really good with this therapy is that there's no downtime, again, because that's what we really believe in, being able to get people in, do the therapy, get out, and keep doing what you're supposed to do all day, right? So many men don't want to have the surgery. They don't want to have the downtime. You don't want to walk around with the bandages and, have everybody see that you've done something. And some of the therapies that are out there, can sometimes distort your face a little bit and can cause nerve damage. Believe it or not, I've had several people come to me with trigeminal neuralgia after a facelift because you're kind of hurting the nerve. Yeah, that's pretty crazy, isn't it? So those things can happen. So what's really great with this is again, it's non-invasive. You come in, half an hour, 40-minute treatment. You go out and you're yourself, but you just look tighter and firmer and younger. So you're not going to distort your face in any shape or form.
Okay, and now I think everybody's sitting at the edge of their seat and they say, all right, how do I get some information? Okay, it's called CARMENCARELaser.com. That's what you're going to get on the web. And you go to CARMENCARELaser.com, or you can just call for an appointment, and that number is 561-405-9577. Get your pencils out. This is Pencil Talk Radio. Means that you get your pencil and you write the numbers down, keep them in a safe place. 561-405-9577. We're talking with Leslie Carmen, who's the clinical director, and BECCA KALLAUS, which is the marketing director. Did I do it? Yeah, I did it. Marketing director. Well, it's a beautiful name. I don't want to mess it up anymore. Marketing director from Carmen Care Advanced Laser Therapy. And they are located in Boca Raton, and they really do care. You can hear it on the voice. That's the one thing about radio that I love. People just can hear who you are on the radio. They listen, and there's a certain spirit that comes through the airwaves.
Beautiful.
Did you know that?
No, I didn't.
Yeah, it does, because if someone's like you, oh, no, and nothing comes out. But when they're good like you, you're both sparkling. I've always said that about you. And now now talk a little bit about the detox. Who wants to talk about that?
Yeah, sure, I'll go with that. So the detox is something that is, again, a combination. And we have toxins in our body. We're I'm sure, aware of it. But the thing is, so we can have sulfa, which is in byproducts. It's in all the products that have been packaged. And the sulfa attaches itself to the red blood cells and just slows down our body. And you actually become like you're in a gray, foggy state. And every time we can detox the sulfur from patients, they come back to me after about 24 hours and they say, I feel better. I see clearer. I have just a better feeling about myself. I sleep better. I'm emotionally stronger. And we see such unbelievable changes. Again, just with Lee, I was doing that with her too, because she had several toxins from being here, and she had the herpes zoster, and she had different herpes types, and she had also arsenic because she eats a lot of chicken and rice. So when we detoxed her from that, the fantastic thing is she used to have terrible stomach pains when she had her mens, and she'd have terrible cramps. They're gone completely. And then she also reported to me that her nosebleeds are completely gone. She used to have nosebleeds 3 to 4 times a week. So they stopped. So things that we're not even aware of really are just healing on their own. So not only do you feel better, sleep better, but other things can happen that just make you, we call it like a wellness program.
So are these pills you take, or is this
Not
a drink
at all.
you take?
Not at all. So this is a vial that holds the vibration of the toxin that your body has. And when your body can match up with this vibration and the light passes through it, your cells release this. It's a chemical release of that toxin. Goes in, out through your bloodstream, urine, stool. And within a day, you see the results. It's really remarkable. Invented by Dr. Lee Cowden. He's was a heart surgeon, and he's invented this. There's a lot out there, or more information starting to come out on it, and it's really quite remarkable, without any side effects, anything like that, or any invasiveness on that part.
Have you both tried it?
Yes.
Yes. Of course.
I was a little nervous asking you, but I know you don't do anything like that time.
No.
All of our staff, that's the beautiful thing. All of our staff has a story about all of our services. So the only, I haven't finished my detox, but we always put everything else before ourselves. But there was one toxin, I don't remember which one it was, but after one detox, I slept. It was insane. I think I slept for 15 or 17 hours the first night, and the second night I slept for 12 hours. I've never slept more than 10 hours in my entire life. Even as a teenager, when you're always sleeping in, there was nothing in the world that was going to keep me awake. That was how tired I was, and it was just from the detox.
Knowing you, I would say 7 hours is your max.
Yeah, that's 7.5. That's pretty accurate.
Right.
But I'm pretty sure it was roughly 15, 16 hours I was asleep for the first night. So, it's over 90% of the people that have been through our Carmen detox, they have significant experiences. So, for me, it was sleep. For Lee, she doesn't have the nosebleeds anymore. We think that that's why she, before she was 99% better with the trigeminal neuralgia. We're cautious about saying that she's 100%. We never want to make claims that we can't substantiate, but she hasn't had a shock, I don't believe, since we did the detox for the herpes zoster virus. And then her menstrual cramps, she also had really, really, really heavy periods that were really interfered with her life. That's gone completely now. We had a woman that we talked about last time on the radio who she had, you recall that story a little bit more than I do, but
she came in with terrible headaches, migraines since she was 11. And I asked her to think back what she did. And she remembered being in Jamaica on the fields with her uncle, and he was spraying herbicides. And that is dioxin. And we found dioxin when we, muscle tested her. As soon as we got rid of that dioxin through the laser, again, non-invasive, she came back and her headaches were gone completely.
You just said something, and I want you to follow through that. When you say you test, how do you test so you know what they are getting rid of?
You can look up muscle testing or kinesiology, and it is really known. I mean, sometimes you can have people say, "Oh, this is quackery."
Oh, I've had it done. It's
right.
definitely.
It works.
I mean, I held some sort of a pill. I could not get my arm down. Right?
Exactly.
I know what that is.
And that's how it works.
Kinesiology.
Right, and it really does work. And so when you have this vial that has, again, this toxin, and it matches the same toxin in your body, your arm cannot stay strong because it matches that vibration. It's all communication between energy, your cells, and so forth. So it is very, very real. And what surprises me every time is the accuracy. So I had one woman, and I was testing her, and she had pollution detox, and I had never had that. And I said to her, pollution detox, have you been in China or any place where there's a lot of pollution? Yeah, I go there all the time. And so those are things that just matches up. One gentleman, he was testing strong for food poisoning. And I asked him, have you had food poisoning lately? And he said, yes, I had food poisoning a few months ago, and we couldn't get rid of the bacteria. We couldn't do anything because of some other reasons. And so the body really talks to me through those vials.
So then the kinesiology tells you exactly what the problem is, right?
Exactly.
And then when they do the vial, is it before or after? It's the before you use the vial first, and then you
use the vial to test to see what you have, and then the vial is used in combination with the laser to so then
get rid of that.
It matches that vibration that's in the vial. That's kind of in a nutshell.
Yep.
So I think it's kind of a plus that Leslie currently is the only one who does the laser detox in our clinic. I think it's kind of a plus that especially when she first started doing it, she didn't know what most of the labels on the vials were. It's like BMAA, for example, is one of the labels on the vials. And so with the very first patient that we did the CARMEN detox on, Phil Ackerman, he was the one who was here. I can say his name publicly because he came on the radio, and he's a big advocate of everything that we do. He was a Vietnam vet, and BMAA came up with him. And at the time,
Agent Orange or something.
Yeah, he had Agent Orange poisoning, and so at the time we didn't know what BMAA was. But now that's a really big thing for all of Florida currently, because with the blue-green algae bloom that's happening in lots of areas, there are 4 counties that are currently in a state of emergency, including Palm Beach County. Palm Beach, St. Lucie, Lee County, and one other one, I'm drawing a blank at the moment, but are all under a state of emergency because of blue-green algae bloom, and it releases a toxin called BMAA, which has been directly linked to causing Alzheimer's, ALS, and Parkinson's. So sometimes it has short-term effects and sometimes it doesn't. So that means that everybody in that area is exposed, because it's not just if you swim in the water, it's if you eat any local fish, and it's even in the air as well. So anybody in those areas are actually exposed. I think it's being kept kind of quiet because there's not much that you can do about it except come to us and get detoxed.
Interesting. So I know I saw it in the newspaper. They've done a big thing. I saw it on the internet, and right, and so it's pretty serious.
Yeah, we've posted some of the articles on our Facebook page. So if anyone has any questions about that, they can look on our Facebook page. They can call us, and we've become very knowledgeable on the subject, so we're happy to answer any questions. But to my knowledge, there's really nothing you can do about it except to come to CARMEN Care to get a CARMEN detox. But we're actually offering for people who live in those areas and are continually exposed. It's something that you would have to get detoxed on every couple months, something like that, 2-4 times a year. But we are offering discounts for people who are continually exposed, so that can be affordable for you to maintain your lifestyle.
That was a question of mine. So how often should you get detox?
I think
not just for that, but for anything.
Well, for most things, unless you're getting to continual excessive exposure, it's
the one-time thing.
For the most part,
be. Yeah, it really just depends. Like, this lady who had migraine headaches because of the dioxin, she's not going to be exposed to that herbicide anymore. So for her, she doesn't need that. But if you have, let's say, the BMAA, and you're in the areas, you might need to retest that every couple of months.
So now when people come in, you have to, it sounds like a buffet to me.
I know. It's like you got to say all these different things. But we are putting these packages together because we're seeing that together we're just getting the best effect possible. So we're saying, come in and we're going to offer, do the detox, get rid of those toxins so your body can heal better. Then do the laser so you can get rid of the pain. Do the vibrational plate so we're strengthening your muscles that have been weak, because if you have a bad back, you don't have a strong abdominal. So get on the vibrational plate, strengthen those abs. Then we're just offering even now a little session where you can tone and tighten with what is she? A
personal trainer.
A personal trainer. Yeah, thank you.
So she's toning and tightening.
Yeah,
yes.
Just showing exercises, showing how to continue keeping your abs strong. So we're putting together this whole package that's really going to be fantastic, because we want to reach 100% success rate.
Yeah.
That's our goal. We want everybody to get better.
I could see lines forming outside your door.
Yes.
And we are offering a special where for the Venus Freeze, for that skin tightening, wrinkle, getting rid of your wrinkles, for the first 20 people who purchase a package, we're offering a free second body part for the first 20 people.
A free body part. And what would that body part be?
I missed my coffee today.
Well, you do your face, and then you get your neck for free.
I'm kidding. Yeah, it just,
Get 2 necks.
Yeah, 2 necks.
No, but I mean, it really is an amazing deal, and
Yeah.
it's just to introduce our new services, so it's not something that we'll ever be offering again. So it's just for the first 20 people. We've received a lot of interest, so the time is limited for that
It's true.
offer.
Well, we're happy that you're doing this on the radio. This is a first, and you heard it here. And it's Leslie Carmen, who's the clinical director, and Becca KALLAUS, who's the marketing director from Carmen Care Advanced Laser Therapy. Stop the pain and start the healing. We have to have some more things to say.
And I
Please-
start the beauty.
Start the beauty, right. We've always been beautiful. You're just making it, you're shaping
A
it
little
up a
more,
little bit,
right, exactly.
So the phone number to call is 561-405-9577. That's 561-405-9577. And they're actually located in Boca Raton at 3301 Northwest 2nd Avenue, Suite 100. And all you have to do is just make that phone call, and you can get set up with it. So, do you find that you're treating more men or women
Well, you mean for the pain
for anything?
or anything? Actually, both. Both. I would say both.
Yeah.
Men, obviously, they've had a hard life, working very hard, so they have a lot of times back problems, knee problems. So we do treat a lot of men, that have been lifting and driving and just very, very active. But obviously the women too, everybody's suffering with back pain. Unfortunately, that's one of the most common painful conditions that we treat.
Well, of course, the migraine headaches are very, very common. I know people now use Botox
Correct.
for this also
Yeah.
because they haven't been able to be helped, but maybe they need to try your laser therapy because it would be probably an easier way to go.
Exactly. Well, especially the detoxing part, because that is what we're seeing is migraine headaches, especially when you've done everything. So you've checked that you don't have a tumor. You've checked that there's nothing else wrong with you, because remember, we don't diagnose in our clinic, so we just treat the pain. And so when we find people coming to us that say they've tried everything, then we're safe to know, okay, there's nothing else seriously going on. There's something else underlying. And that's when the detox comes in very, very handy, because it will usually be something that is in their body holding them back.
Well, nothing holds both of you back. And I'm so happy that you're here again, giving all this good news. And
Thank you.
I'm going to look forward. Maybe we'll bring some people next time on the air so we can have them talk. Thanks for being here.
Thank you, Anita.